Hello, this is Brian Rosner with Biomed Publishing Group, and if you look around here, you'll see that the National Weather Service was right about us getting a blizzard. You can see that we got 2 or 3 feet of snow. Now, although I think snowstorms are pretty exciting, it's kind of fun to be cozy inside your house, they also present a major inconvenience. During a snowstorm, you can't really get out of the house, the roads are blocked, you can't really get to the grocery store and that type of thing. And this got me thinking about the similarities between snowstorms and chronic Lyme disease treatment. You might not think there are any similarities, but believe it or not, there are. Take, for example, hyperbaric oxygen chamber treatment. Even though that treatment might work fairly well, in order to beat chronic Lyme disease, you really have to keep up with any treatment for, about 6 months to 4 or 5 years, sometimes a little bit less, 2 or 3 years. So the problem with hyperbaric oxygen chamber treatment is that it's just too constraining, just like a snowstorm. During the treatment period, you're expected to drive to a hyperbaric oxygen chamber clinic 3, 4, 5 times a week. You're expected to sit in a tank for 2 or 3 hours a day. It costs a whole lot of money, maybe $200 or $300 a day, and that's just not sustainable for the long haul. If you had to do it, maybe once or twice a week, it wouldn't be all that bad, just like going to the dentist. When you go to the dentist, it's inconvenient and very constraining, and you feel sort of trapped, but you only go to the dentist once or twice or 3 times a year, so it's not that big a deal. So if there's one lesson that I would like my viewers to get out of these video blog posts, if you only remember one thing, it's that chronic Lyme disease takes a long time to get rid of, and in order to stick with the treatments, they really have to be sustainable. Now, in my books, I talk about a couple of different Lyme disease treatments that are sustainable, that you can do for a very low cost, in the privacy of your home, on your own schedule, and it really gives you the freedom and flexibility to live your life. Now, I understand that someone with chronic Lyme disease can't do all the other activities that normal people can do, but if you pick sustainable treatments, you'll be able to have a fairly normal life during the recovery process, and you'll be able to be pretty comfortable. Some examples of those types of treatments that are sustainable are supplements that you can keep in your house, Rife machines that you can use at home, saunas. There are many saunas that you can purchase and keep in your house, and that type of thing. Examples of treatments that are not sustainable would be hyperbaric oxygen chamber treatment, fancy clinics that require you to drive, maybe 30 or 40 minutes and spend thousands of dollars and stay at the clinic for a long time. That's not a sustainable treatment. Going to see doctors quite often, 2, 3, 4 times a week, that's not a sustainable treatment. IV antibiotics are one of the least sustainable treatments. So you really do have to keep in mind sustainability. Now, when we talk about fancy clinics, like clinics, where they charge you $2,000 or $3,000, or even $5,000 or $10,000 or $20,000, these clinics can actually have treatments that are very valuable. But the problem is, when you leave the clinic after 2 or 3 weeks, the treatment usually doesn't stick with you and the infection starts to come back. And that's one of the problems with chronic Lyme disease, is the long treatment period, and that's what the sustainable treatments aim to basically solve, is that inconvenient long-term problem. Now, I want to make a note here that's very important, and that is that this video blog post only applies to late-stage chronic Lyme disease. If you have early Lyme disease or just got bit by a tick, then it's important that you pretty much ignore the inconvenience of any treatments you might be looking into and get help right away. And in that case, IV antibiotics, while they are inconvenient, they still may be worth doing, because they can give you the chance to completely get rid of the infection right off the bat and never even have to deal with chronic Lyme disease. So remember that this post is for chronic Lyme disease only. Also remember, I really do feel it's important that this is basically the most critical topic that I'll be talking to you about. That is the sustainability of Lyme disease treatments. Can they be done over the long haul without feeling like you're trapped in a snowstorm with nowhere to go, and without creating that sort of depression of knowing that you're going to have to be continuing the same inconvenient, expensive, time-consuming treatment over and over and over again for a long time? So I'm Brian Rosner with Biomed Publishing Group, and if you want to learn more about my research, go to lymebook.com. That's lymebook.com. I also want to remind you that I am a journalist, not a medical professional, so this video blog is for informational and educational purposes only. Okay, I'll get back to what I was doing before I started talking to you, and that is shoveling snow. Have a great day.